Dr. Powell Wilson.
Thank you very much. Good evening, Jamaica. The Council of Community Colleges of Jamaica, through our chairman, Dr. Orville Beckford, welcomes this opportunity to share with Jamaica and parents, students who are exiting the secondary level, in particular, about the post-secondary education opportunities that are available right here in Jamaica. So who are we? The CCCJ, and that's 3Cs. We are an agency of the Ministry of Education, Youth and Information. Among many things, we coordinate and supervise the work of the community colleges in Jamaica. So our institutions, there are 10 such institutions now, and they are strategically located across the island with 23 campuses. So very quickly, I'll tell you the institutions, who they are. Bethlehem Moravian College, Brownstown Community College, College of Agriculture, Science and Education, Excelsior Community College, Nakalva Polytechnic College, Knox Community College, Moneague College, Montego Bay Community College, Portmore Community College, and Trenchtown Polytechnic College. These institutions, they offer a variety of programs. Programs at the post-secondary education level to include certificates, diploma, associate degree, bachelor degrees. Also, they have continuing education programs in the institutions. So you can complete your CSEC classes or your CAPE class subjects. Programs are delivered, well, prior to COVID, programs were delivered full-time, part-time, on weekend, early morning. So the institutions are very flexible in the offerings. The community colleges, they are built around the community, so they facilitate the community on the whole. Now, heading into the new academic year, the programs will be delivered in additional modalities. So we'll have blended learning that is online and face-to-face, and some institutions will offer some programs fully online. How do you get into these institutions? In particular, the students who would have just completed their CSEC exams or their CAPE exams. At the council or institutions, we do not turn away anyone. So you will have a chance to continue your education at any of our institutions. Application process, you apply online to these institutions, and once you would Google the name of the institution, then the application, the website, it will take you to their website. Matric entry requirements, we have a standard entry requirement of 5 CSEC subjects. We do accept City and Guilds, Stage 3 Math and English, and other alternate matriculation. All students, if you are waiting on your CSEC or CAPE results, we encourage you to apply nonetheless, and the institutions will guide you accordingly. Thank you.
Thank you, Dr. Powell, for the information you just shared with all our parents there in virtual land. You would have heard that the community colleges will have the blended modality where some classes will be face-to-face and others will be online. And you'd have heard what it takes to matriculate to the colleges. Thank you for that information. I now hand over to Dr. Kassan Troop, who will talk to you a little bit about other plans that you might not have heard of before. She's going to talk specifically about sixth forms. She's going to talk a little bit too about boarding institutions, and of course she will give a summation of of what will happen in primary and high schools. Thank you so much, Dr. Troop. Here you go.
Good evening, colleagues. Good evening, Jamaica. Good evening to my parents who are listening. It is my joy to come back this evening to share with you the plans that we have for our education sector. As you know, parents, the education sector is a development sector, and we have a responsibility to be responsive, agile, and to move with what the contemporary demands are of the 21st century. So you would have heard about the programs of some of our tertiary institutions. And I want you to know this evening that the Ministry of Education has rebranded our career advancement program. And in doing so, we are going to be expanding our sixth form program. So you are aware of our K-13 strategy. And under our K-13 strategy, you would have heard of the ministry expanding the secondary program to 7 years instead of 5 years. So some students would have had the opportunity of going to sixth form, which is an additional 2 years. Come September, the brand new school year in September, even with all that is happening, we have a responsibility as a Ministry of Education to account for all our grade 11 students, to make sure that they can pursue higher studies, post-secondary studies, to make sure that they are attached to some program of learning or as they prepare for the world of work. And so this year, parents, we have rebranded our career advancement program to include the sixth form program as you know it. And we are now going to break that program down in what we call pathways. So our parents, you are already familiar with the concept of pathways under our Alternative to Secondary Education program. And so we are using the same approach in our post-secondary program. So our sixth form students now will be exposed to sixth form under 3 pathways. Pathway 1, which we call the traditional sixth form that you are accustomed to. Pathway 2, which we are now referring to as a technical sixth form. And pathway 3, which is our general sixth form. So the traditional sixth form, those students who would matriculate with their 5 CXC, including math and English, would have enrolled in their traditional sixth form at any institution. We will still retain that formula. Now, the additional students in the past would have accounted for at least 1/3 of our grade 11 cohorts moving on to sixth form, others into the world of work, others into community colleges. And the parents would have had to assume the cost for the community college program. Under this framework, our students, all students would have an opportunity to enroll in one of our 3 pathways in sixth form, and this program will be covered under the resources of the government. So all students' parents, we are expecting all our grade 11 students to go back at the end of this exam period when we will receive the exam results on the 27th of September of this year. We are expecting that our students will go back to their high school institution and they will indicate the area that they would want to pursue based on their subjects that they would have attained at the CXC, in addition to the NCT VET, as well as any other program of study that they would have pursued, like the City and Guild. So every student will have a place in our sixth form student for the new academic year. And we are doing this program. I know you're going to ask me, where are we going to put them? So we are doing this program in partnership with our public and private tertiary institutions. So some of our grade 11 students will pursue their sixth form program on tertiary campuses. So we have already started the consultations. We have met with our high school principals. We have met with our tertiary principals, and they will now continue the dialogue. We have developed the framework. We have put together the instrument that they will use for this partnership. And so the dialogue is continuing now as to how our students will be attached, who will be retained at the high school level, and who will pursue their sixth form program at a particular tertiary institution that is in close proximity to the high schools. So we are grateful that we'll be able to provide, and as I said, our technical and general pathway students will be provided for by the government of Jamaica. So parents, get yourselves ready. All our students are supposed to pursue and continue their post-secondary education via our sixth form program in partnership with our tertiary institutions. So I want to speak specifically to that this evening, Kesia, because I know our grade 11 students are wondering, where will we go come September in all of what is happening with the cost to cover tertiary institution. It may cause them to think that I'm not able to go to tertiary institution this year. The good thing, parents, you are able to access your post-secondary education at your high school, and your high schools will partner with the tertiary institutions. The government will cover that cost, and our students will do this in pursuit of their associate degree or in preparation for their associate degrees.
Okay, Dr. Troop, a whole lot of good stuff this afternoon. Did you hear the passion and the energy? All our students are expected to enroll in a tertiary institution, post-secondary, that's a term? Okay, let me make sure I'm using the correct term. In a post-secondary institution, it's important. All right, and so now I move to Dr. Tamika Benjamin, who is the National Mathematics Coordinator here at the Ministry of Education, and she also has another portfolio that supports tertiary education in the ministry. Thank you so much, Dr. Benjamin. Revving to go.
Good evening, colleagues, and good evening, Jamaica. Happy to be back here to provide some more information as it relates to what is taking place as our tertiary institutions prepare to reopen, for most of them at the end of August. And just to reinforce some of the key principles, considering all that has been taking place with the COVID-19 pandemic, that our tertiary institutions are prepared. They have been working just as our principals at the secondary and primary levels have been working. And all of the guidelines that have been developed by the Ministry of Education, Youth and Information are a part of the protocols that will be implemented at the tertiary level. So matters relating to the wearing of masks, social distancing, those will become a part of the operational context within all of our tertiary institutions. As a result, as Dr. Powell Wilson would have mentioned before, it therefore means that classes will be delivered using mixed modalities. Some institutions are going to offer some programs fully online. Others will facilitate some students on campus, clearly in limited numbers, to ensure that the requisite protocols are observed. And there are some institutions that are trying to offer a level of flexibility to ensure that students who may not have access to the internet or may not have the devices to access online classes are able to access their classes in settings on the campus. It may not be face-to-face with the lecturer standing in front of them, but the lecturer may be zoomed in and the students are able to use the facilities of the institution to participate in the classes. So as I encouraged in the other setting, in the other forum, I want to encourage students again to ensure that they know what is going to happen in their context, because it will vary from institution to institution, the modalities that they will employ. But most, I think even the University of the West Indies, will not be fully face-to-face. And so it's very important for students to become aware of what their institutions will be doing and what may be required of them to be able to access their classes. In addition, the protocols will affect boarding, and I have to keep repeating it because I'm very aware of the number of students who plan and have been boarding on campuses, but are also aware that the capacity for boarding on almost every single institution's campus has been reduced. And so students need to be proactive and make sure they make contact with the institution. If you're already on hall, you may want to find out what the capacity is. Will my space be reserved? And see if you need to put alternate arrangements in place. As if a room was accommodating 3 students, most institutions will no longer be housing 3 students in that room in the year ahead. Students can expect increased sanitization routines on the campuses, similar procedures that I know we are employing here at the Ministry of Education with temperature checks and sanitization on entry. Those will apply at the tertiary level again. I think by now that's a normal part of our day-to-day life, so we can expect to see that in those institutions. In terms of the students who would just be completing CSEC or CAPE, well, I won't talk about CSEC because we're expecting them to go through the sixth form program, which will take them, some of them, through the same tertiary institutions as Dr. Troop would just have mentioned. But those who would have completed grade 13 and are awaiting their results, or grade 12, because there are some students who transition into some other programs at the colleges. But for those students, and the results will become available on the 27th of September, they need not worry that they will be left behind. Or colleges, both the teachers' colleges and the community colleges, have already put systems in place to ensure that there's a delayed start so that these students can begin their courses once the results are available. So again, students need to ensure that once they get their results, they make contact with the institutions so that they are able to start. I believe most are planning to start for early in October. And what's likely to happen for them in many instances is their semester will run straight through to December, and examinations which would have normally been administered at the end of December will now be administered early in January. So all of our public institutions have put systems in place to account for the delayed release of CSEC CAPE results. And so students need not worry about that affecting their ability to access the next level of the education system. And then the last thing that I would want to share is the Ministry of Education, through its Tertiary Students Assistance Program, would offer annually a suite of scholarships and grants to students accessing tertiary education. We are about to start interviewing the students who applied for the scholarships. Those would have been students who applied to do math education, science education, that would be physics or chemistry, geography, special education, or engineering programs at either the University of the West Indies, the University of Technology, or the Caribbean Maritime University. Interviews begin on Tuesday of this coming week and will run for an entire week. So students who applied, we're encouraging you to check your emails. We would have already started within the last 2 days to send emails out to students who are shortlisted, who are successfully shortlisted. And so we're encouraging you to check your emails, including that spam account, to see if you received an email from the Ministry of Education, which would indicate the place and the time for the interviews. And so if you have a challenge, you will be able to respond to the email if there is a challenge with you being able to attend the interview at the date and time provided for. We are still in the process of downloading the thousands of applications for the grants. We got about 6,000, and when I last checked, we were halfway there on Friday, yesterday. And so those interviews will start once the scholarship interviews are finished, and we will phase those in. So again, those students who applied for the grants, you too should be preparing to start checking your emails on a regular basis to ensure that you, to see if there is a message indicating the date and time of your interview. And I'm really encouraging the students to be proactive, because it's going to be difficult for us to be calling every single person. So we send out the emails and we're asking, it's the same way you applied via email, we'll communicate with you via email. Thank you.
Thank you so much, Dr. Benjamin, for the information you just shared with all our parents and all other stakeholders who are listening to us just now. I want to just remind everyone that Dr. Mara Husang is with us. She's our specially invited guest. She is a consultant pediatrician at Bustamante Hospital for Children. She is here to take all your questions regarding safety during this COVID-19 period, especially as it relates to your preparation for back to school. We want to ensure that you get the information from the source. I know how it is. Everybody is a doctor these days. Everybody Googles everything and everybody's an expert. But we're bringing the expertise to you right here. You're getting the information directly from the source. That's important. All right? And so I just want to quickly talk about the National Parenting Support Commission. I promise not to be long. I see you have questions already pouring in. But I want to just talk to you just a little bit about the National Parenting Support Commission. You'd have heard me say that we're an agency of the Ministry of Education, Youth and Information. And I guess you want to know, how do we operate? Well, we operate by ensuring there's parental involvement in the education sector. We believe that when parents are involved in the education sector, their children's performances, academic performances, and their social behaviors improve. We do this through the implementation of the National Parenting Policy. And the policy hits the ground through a suite of programs that we have in schools. I'm just going to mention a few and just to give you a synopsis of what these programs are. So we have a program called Stay Connected, and it's a high school transitioning program. How are schools selected for this program? Well, we look at what the National Education Inspectorate reports say about things like absenteeism, attrition, antisocial behaviors in school, and also parental involvement, which are components of that assessment. Once we look at the assessment, then we choose a school we believe is in need of greatest support in these areas. This year, we have implemented the program in 3 parishes: Kingston, St. Thomas, and Trelawney. So we have Stay Connected now that we're implementing in Paul Bogle High School, that's in St. Thomas, Cedric Titus High School in Trelawney, and at Clancarthy High School right here in Kingston. We implement the program right at grade 7, and we literally stay with parents. We talk about age and stage of maturation, what strategies they should apply, so that they're effective in their practices, because we do not want our children dropping out of school. And we work with the parents through the PTA construct right through to 5th form. So once we implement the program, we're there transitioning with the parents and those students all the way to 5th form. And then there is another program that we have called Parent Place. And this is just a place that's attached to primary schools, or they could be attached to a faith-based organization, a library, or a community center. We have just about 125 parent places attached to primary schools. We have 8 attached to faith-based organizations, and we're now opening another 8 schools that we will have attached to schools in volatile communities across the country. We believe that that support is important. Now, we know that when children drop out of school, they're likely being lured into gang activity. And so these parent places become a hub of activities that support parents. What do? We offer early literacy intervention. There is a correlation between poor literacy levels and crime. That has been established, irrefutable. And we offer parenting education. We offer psychosocial support, and we also offer skills building. What we do is we talk to parents to get some kind of idea of what skills they have that they need certification in, or what skills they'd like to develop. And we partner with Heart Trust to deliver the course, and then these parents are certified many times, after which they can now earn a living, because the policy says parents must provide the resources so their children can achieve. If you're not working, it's going to be difficult. So we do that through the Parent Place. And finally, I want to talk to you about our flagship program called the Parent Mentorship Program. This is where we recruit adults of unquestionable probity. So you must not have run afoul of the law. And especially if you would have harmed a child, then sorry, you cannot be a part of that program. But the Parent Mentorship Program is the one that inspires me so much, because here we have these group of volunteers who are working in schools to ensure the parental involvement component is pushed and parents are involved. And then they support our efforts through 2 other tiers, the community level and the home level. At the community level, interestingly, they're expected to establish parent clubs, and we have several parent clubs that are thriving, doing very well. Why are the parent clubs important? Well, policies such as these, we talk to the parent mentors about them. We break them down into simple language so that they can now go back to their communities and share what these policies mean, how they impact their children, what they need to do as a parent to support the policies. We have one very close to here that I'm very proud of, Fletcher's Land, a good, very active parent club in Fletcher's Land. We also have several in St. Catherine. So there's a lot of work that we do that Jamaica still doesn't know about, and we aim to change that. We want to get you abreast so that you too, should you have heard about one of our programs, you can also get involved. Understanding that parental involvement is a whole set of activities. And I still maintain that you don't have to go physically on the plant to be involved in your child's school. So that's me in a nutshell. This is a National Parenting Support Commission, an agency of the Ministry of Education, Youth and Information, who is resolute in our commitment to ensure that parents remain involved in the education sector. And so somebody's phone is ringing. I figured it's mine. No, it's not. Somebody is calling me directly to ask a question. Well, I'm going to encourage that person to send me a text, and I will read it. I think somebody out there is very enthused and wants to ask me a question. Well, what do you know? It's my mother from overseas. That's the truth. All right. So we'll ignore mommy for now, and we will continue the presentation. All right. So we're doing so well with time. It is 7 minutes after 7, right on the mark. And so I'm going to now move to the questions that you have sent in. So the first one is, please explain the extended day. Dr. Troop.
Okay. So I think we have a parent there that is already aware of the curriculum implementation approaches that we communicated in our last 2 parent sessions. So just let me go quickly. Parents, we would have approved several approaches based on our school's context. And so we have schools that will be able to operate normally, what we call the whole day approach, from 8 o'clock to 2:30, or whatever schedule you were on prior to COVID. We have schools that will be able to operate normally because of their enrollment and the infrastructure support that they have at their schools, in addition to the fact that the Ministry of Education will support them in procuring temporary learning spaces via tents or the rental of nearby spaces via church halls, etc. So because of that facility, some schools and majority of our schools will be able to operate normally. So we have approximately, 569 of our schools that will operate, most of which would be our primary schools. So our babies, most of them, will go to school in the normal setting. And of course, even though we are saying normal whole day approach, the schools will be observing physical distancing. Of course, all the infection prevention control protocols will be in place. That's just non-negotiable, right? They have to be in place. And our safety and security officers, our principals, guidance counselors, nurses, deans of disciplines, all of these persons are working assiduously to make sure that the schools are ready come September 7th. There is another approach that we call the rotational approach. In this approach, students will go to physical engagement on an alternate basis. So for example, on Mondays and Tuesdays, a particular set of students will have face-to-face interaction. Wednesday and Thursday, they may be engaged virtually or what we call using the blended approach. Because we know that some schools and some areas may not have internet connection, the blended approach will include televised learning that the Ministry of Education is supporting. It will also include computer-based, computer-aided learning that does not rely on the internet. And also it will include printed packages, so learning kits, including worksheets, handouts, your textbooks, your workbooks. The learning program will be included, those things will be included in the learning program, which is what we call the blended approach. So face-to-face, televised, computer-aided, and of course, printed learning materials. So that will take place in the rotational approach, and it will also take place in the whole day approach. Blended learning is not just about being remote, right? You can engage in blended learning in your face-to-face engagements. We will also have extended day. Now, the extended day approach is not necessarily new. There are several of our schools that are on this program. And in this program, a particular group of students will be starting school at least 2 hours before another group of students. So the school is divided into 2 groups, upper school and lower school. And the upper school students will start their school, for example, at 7:30, and their school will run from 7:30 to 2:30. And then the upper school students will join them 2 hours after. So they may come in at 10 o'clock or 10:30, and they will continue their learning program up to 3:30. So there's a 2-hour difference between the different groups of students, and that is what we call our extended day. As I said, it's not new. Many of our schools are operating that program even before COVID, and that helps the school to manage the demand for physical space. And so timetabling in that modality is very important because we have to make sure that even though students are sharing the space at a particular time, we manage the availability of the room. So some students will be out into the labs or they will be out in PE and so while other students are using the physical spaces. So it's a particular approach that is managed by timetabling, and that's why they extended their approaches. And of course, we spoke at the last time about our homeschooling. A number of our parents have queried about that approach, and the homeschooling is managed by our independent schools unit. We actually have a protocol for it, and it has its place embedded in the Education Act, so it's not something that is just hurry come up because of COVID. We actually had students and parents who operated homeschool in Jamaica, and it is supported by the Ministry of Education. So parents, you can apply at isu@moey.gov.jm. That is isu@moey.gov.jm. Once you indicate such, we will send to you what the application form looks like. What are the things that you must have in place? For example, you must show that you can manage the learning episode of the students. We must know the person who will be engaging the students and the facility that will be in place for the students' continued learning. All of those are a requirement for the ministry to approve your homeschooling process. We have a responsibility, parents, to make sure that our students are covered and they are being provided with the best quality education, even if it is being provided from home. And another approach that we have approved is the online approach, and you would have heard it spoken about mostly for the tertiary sector or post-secondary sector, because of those students are more mature and can manage that kind of modality. And so we would have approved for the grades 12 and 13 for the online program, but most schools are blending that program. There's no over-reliance on one modality. So those are the curriculum implementation modules that we have approved. We have also seen a few school parents asking for the staggered approach, which is a mini version of the shift system where a normal school day will operate for 4 to 6 hours. In the staggered approach, principals would reduce the number of hours that persons would be exposed to for their contact sessions, for example, from a 6-hour school day to 4 hours or 3.5 hours in some cases. And that would see some students coming to school every day from 7:30 to about 11:45, and another group of students coming in at 12 to about 3:30, 3:45. That is how our principals and our boards of management are trying to restructure and reform as we respond to the demands of COVID-19. Again, all those modalities will have to observe the social distancing, physical distancing. They will have to put in the hygienic stations, the wash stations. All the hygienic practices must be in place. Parents, no compromise. And I know some of you are scared. We are all scared. We don't know what tomorrow holds. We can only plan and prepare as best as possible, and I can only guarantee that we will put the support and the systems in place to make sure our students and teachers are safe.
Thank you for that comprehensive response, Dr. Troop. And we have a question from Tracy and Wisdom Reed. Thank you so much, Ms. Reed. And the question reads, what about students who have done CXC from last year and are not in a program now? What about them? Dr. Benjamin? No? Okay, Dr. Troop.
Well, those students are normally would probably pursue other programs of study. And if not, the community colleges are available or teachers' colleges are available. So there are tertiary programs that are set up, and that is why we have the tertiary sector here focusing on that today, because we know there are many students who are out there who may not be attached. We are asking you to visit these tertiary institutions, visit the websites if you can, call these colleges, and they are going to be ready to share with you the number of programs that they have available. There are a plethora of programs out there, and all the programs are designed for students to enter at different levels. So you may not have all your CXCs. There is something for you. And that is why we have even modified our career advancement program to look at pathways, because we know that everybody is different and one size does not fit all. And as an education system, we have to tailor our program so we do not exclude anyone. So in the same way we have done so for the pathways, everybody will have a place in the pathways. And of course, there may be hybrid models too, depending on how our students are qualified and certified. So those students who are out there and are not attached, just visit your tertiary institutions. There is something there packaged for you.
Just out of curiosity, Dr. Troop, would the sixth form program apply to such a student?
Well, it depends. As I said, we have hybrid models. We will have to look at where the student is now, because at a particular age, that student may have passed the grade 12 age. So the program for sixth form this year is for grade 12. The grade 13 program would have been in place already, and those students would not have been attached. They would have been in other institutions. So we are set up this year to start for the grade 12. So that student probably would have been beyond that age. But we have other career advancement program with our private institutions. And so we can, Ms. Carr, attach these students to these programs. So we are responsive. We want to make sure that everybody is involved into something. So we will not turn back any child. So if your child did not pursue sixth form last year, is desirous, just get in touch with the Ministry of Education. We have institutions that will be willing and ready to modify their programs to accommodate you.
Thank you, Dr. Troop. So I'm going to switch you from your seat for just a little bit and invite Dr. Mara, who sang, to settle in, and you get to rest your voice a bit while I ask another question. So, Doctor, yes. So we're switching out just a little bit, and we're welcoming Dr. Mara, who sang, to the chair. Thank you, Dr. Hosang. We're really so happy to have you this afternoon. There's a question here. I'm trying to find it. Let's see. Question here, Dr. Hosang. Okay. This parent wants to know, what do we say to... Okay. What about students with underlying conditions? What are we to say to those parents? How do they support their children who have underlying conditions to keep them safe during this COVID time as they think about back to school?
Okay. Hello. Good evening, parents. All right. So we have different categories of patients who might have different kinds of conditions. Those that are greatest at risk would be those who are immunocompromised, which means that their immune system is not functioning as well as normal because they might be on medications that suppress or decrease the action of their immune system. For example, or patients with cancers or different conditions like lupus who might be on steroids for extended periods. For those patients, we'd have to be really cautious to try and ensure that they would have a safe environment to working at school. If school is permitted. It all will depend on what is available at their particular institution that the child belongs to. And I think the Ministry of Education has guidelines. So the particular schools will be able to tell the parents what they have available. And I was told for all patients, all students returning to school this year, they should complete a medical. So the parents are expected to be very open to allow the schools to know what exactly are the conditions that their children have. So a risk assessment can be done for that child for that particular institution, and a decision then can be made on an individual basis. So it won't be just a generic care for everybody. So it would depend on what the condition the child has and what are the what's available at the institution that the child is supposed to attend come September.
Thank you, Dr. Hosang. That's a really good answer. So let me reiterate, be very open when you go to get the medical done so that a risk assessment can be done to ascertain what we need to do where your child is concerned. And one of the decisions could be what's the best modality for your child. Should your child be physically on the plant, or is the homeschool option better for your child? It depends. So thank you so much, Dr. Hosang. Please, you could please remain here because I'm sure other questions are going to come in short order. And this question, what do you, and I know this question keeps coming, but Dr. Hosang, from a medical standpoint, should we have our students engage in physical activities like PE? What would you say to that?
Well, generally we try to ensure that there's physical distancing. So the preference would be to avoid activities that you'd have patients coming. Sorry, I keep saying patients. I'm just used to saying patients.
Yes, students.
Students coming in
contact.
physical contact with each other. Sure, the schools will be able to have PE sessions, or will come up with some plans where you still have physical distancing, but the students are still able to exercise, but they're not necessarily within that 6 feet of each other.
So here you go. So we want to ensure that our children are still engaged in physical activity once they maintain the 6 feet protocol. So they must be not engage into sport that calls for a whole lot of contact. I guess that's what we're saying. But there are still things you can do, I am sure. Physical education teachers have been thoroughly trained. They're experts in the area. They will come up with activities, I am sure, that will promote physical health without you getting in contact with each other. Thank you so much, Dr. Hosang. So we're going to switch out again and welcome back Dr. Troop. Please stick around. Thank you for those answers. And Dr. Troop, the hot chair is yours. And while you make your way back, thank you so much, Dr. Hosang. Here's a question for you. So I have 2 high school students, and the auxiliary fee is $5,700 for each, and they're on path. What do I do? Should I pay or not?
Okay, parents, as I said from our last engagement, the ministry does not operate a mandatory fee policy. Our schools will ask for a contribution, and they will do so, parents, because they have expanded their offerings. So in addition to the National Standards curriculum, many of our schools would have had several clubs and societies and other enrichment areas. And because of those areas, they would have to procure the services of some specialists. And so that will incur some cost. So what they have done, parents, and this is done most times in consultation with parents. So programs are not just emplaced or integrated or implemented in schools. It's out of discussion with students and parents, and sometimes it's a demand. Some parents may say, why don't you start this facility? Why don't you start this program? And a parent might say, I will volunteer or I will assist. But it may spark the interest of many other children. And so sometimes the schools want to expand and offer that. What they have done now is to share that cost with parents. So parents are asked to contribute. So what you will see on the auxiliary fee voucher or the school development voucher or the parent contribution voucher, that many terminologies are used at the school level. But what they're asking for is a contribution. Parents, it is not mandatory. We have said from the Ministry of Education that if you can afford to give, we encourage you to give. If you are not able to give, you will never and should not and will not be denied of access to quality education. So it's a partnership. Every good school will succeed because of the partnership. Every stakeholder in that school community is very important, and everything that we bring to the process will redound to the success of the institution. So we encourage our parents to partner and to give what they can. If you can't, parents, don't feel sad, don't feel burdened. Education is available for all, and we will continue to send our grants to secure the operation of the school for the most part. But give if you can, but if you are not able to, please don't feel that you must.
The last part of that answer almost sounded like a jingle was coming on. If you don't feel sad, I almost want to say don't feel mad. I was ready to rhyme. Thank you, Dr. Troop. All right, so we have another question from Sharona Baker, who wants to know what will happen to students who have graduated from basic school, please? Okay. From basic school with a limited amount of students that should be in each class.
Okay. So our infant schools and our primary schools will do the same kind of physical distancing. They will mark their classroom spaces. So we are using signage, we are using markers, where students will sit, where students can stand if they are waiting for something, where parents will enter, where parents should not enter. All of those markers will be at our schools. And so all our students will resume school. For the best of my knowledge at this point in time, school is scheduled for reopening on the 7th. All students will go back to school on their different phased approach as per information shared by your principals. And we will put the necessary systems so our staffing will be adjusted. You will see more adults in the school environment because that will be required to entertain the physical distancing in the classroom. So some classes will be 15 students. You're accustomed to 20, 35, 40 sometimes in a classroom. No, you will not see that come this new school year. The room will be retrofitted and adjusted to only accommodate the number of students that can hold to reflect 3 to 6 feet distance apart. That will also happen for our babies. Our babies will also see a lower student-teacher ratio for our infants at grade 1, at grade the basic school level, infant school level, 5-year-old, 4-year-olds. You will see 10 students to an adult. For the lower babies, you will see 5 students to an adult, and sometimes 8 students to an adult. So that's the kind of adjustments that are taking place, and the Ministry of Education is providing the additional resources for the engagement of additional staff to make sure that we observe this kind of new setting for our students and teachers. I know some of our teachers, Ms. Carr, would have been concerned about the number of sessions that they will be engaged to teach. And because we are increasing the number of classes, right, because we have to observe the physical distancing, teachers, I want to reassure you, your parents, when you're listening, you will not see a timetable that is excessive. You would not see 2 times the number of sessions that you're accustomed to because your classes will be divided into 2. We will engage additional teachers to make sure that you are provided with the support needed for all students to be attended to. Also, you will not see an increased number of sessions. Some parents, some teachers have called in to say, okay, now that we have 3 of the classes will be divided into 3, I now have 3 times, or I have more hours of work. And some teachers would have written in social media to say that they will have to do additional virtual teaching in addition to their regular timetable. No, teachers, that is not how the curriculum will be delivered. You are going to be deployed as per normal. So if you're accustomed to 4 to 6 hours of timetable in session, that's what you will get, and your classes will be reduced to reflect the physical distancing, right? If it is that you are going to be engaging virtually, it is within the same number of required hours that will reflect normal deployment. So you're not going to do 4 hours or 6 hours at school for physical engagement, an additional 2 hours of virtual engagement. No. That's not how the timetable will be designed. And I've seen that kind of query coming from a few teachers. I'm using this medium to just explain to our teachers that we are going to be considerate. We understand the challenges. We know that you're building your virtual pedagogical skills now. We know that you are also fearful. So the classroom setting will be redesigned to reflect the acceptable protocols and to make sure that you can manage and you are going to be suitably deployed as per normal.
Thank you, Dr. Troop. And this question we got a lot since our last session. Many persons were calling the National Parenting Support Commission on our landline number 967-7977. And the question was, how do we apply for homeschooling? I'm so competent to answer, I'm going to answer it. Yes. So you're going to send an email to isu@moey.gov.jm. So that's isu@moey.gov.jm. Okay, and we move on to Bevelyn McKenzie, who says, please address how the dorm setting will function.
Okay. So that has to do with our boarding schools.
Yes.
So I know, for example, that our principals of our boarding schools have been meeting with our parents. So once you are registered in a boarding school, you would have already been engaged more than twice from the report that I have got with your principals explaining to you the limitations of the boarding facilities. So the facilities will be retrofitted to reflect the physical distancing that is required. That's also mandatory. That will result in, as Dr. Benjamin alluded to earlier, that the number of persons that would normally be accommodated cannot be accommodated. And we really don't have additional facilities, and so persons will have to travel from afar, which is not the usual way of doing things at the boarding schools. But the dialogue, Ms. Carr, has started at the school level. I know they have worked out their arrangements already. Some parents would have indicated and asked for transfers. So because of the distance, they ask for them to be specially supported in their transfers to go to a school that is closer to home. We have facilitated those. Some persons, they have loyalties to these institutions and they're attached and they don't want to be separated. So the parents have agreed to work out bus arrangements, transportation arrangements that is being pooled and structured to support the movement of those students based on where they are coming from. So that is being worked out at the school level. So parents, I'm asking you, if you have not yet spoken to your principals, please get in touch with your principal, your schools. The schools have been fully seized on what ought to happen. We have sent out the education and emergency guidelines for the reopening of educational institutions. And in that guideline document, we have a section that speaks specifically to boarding facilities, and so our principals are using those guidelines to get the facilities ready. What I can say is that the health protocols cannot be compromised, and so the situation is being adjusted to reflect that. Again, parents, please get in touch with your school leaders. They are waiting to hear from you.
And Dr. Benjamin, I still want you to reiterate what you said as it relates to tertiary, because I think it's worth repeating.
So as mentioned earlier and in our last engagement, students who would normally board on a tertiary campus are being encouraged to make contact. If you are a returning student, make contact with your hall. Ensure that you are aware of the capacity that they will be able to accommodate for the school year and what alternate arrangements may or may not have already been put in place. I know of at least one institution that is almost like putting out a tender for private boarding facilities. But again, that's not necessarily the approach that will be available for every single institution. So it is important for students to be proactive. It's already August. Classes will be beginning towards the last week in August. And you really want to make sure you know you don't want to travel all the way from the home into Kingston or wherever it is with all your things and not recognize it and then find out there is no space for you. So it's important you be proactive and make contact and see and ensure that your space is secured, or if necessary, you make alternative arrangements.
Yes. And Dr. Troop, maybe you'd want to help me out here. If my recollect is correct, at the high school level, there's still Hampton, there's Monroe College, certainly there's Westwood High School, and I just wanted you to know it was my way of just mentioning Westwood, the best high school in Jamaica, by the way. And so, Bevelyn, I kind of feel like it's a daughter you have, and your question was really directed because you want to know what should happen with your daughter who has to return to boarding school at Westwood High School in Stewarttown, Trelawney. And so you would have got enough information just now about Westwood High School, Ora et Labore. Work and pray. All right, so moving on, just a bit of humor there as we go through this evening. Well, my major concern is our preschoolers, I beg your pardon. Well, my major concern is our preschoolers who are not going to maintain social distance and will not keep on the mask. How are situations like these going to be handled? And what measures have you put in place for them?
Okay. Very good question. I mean, we are also struggling with our masks, so I can just imagine what will happen for our babies. And I must report to you that out of the high school program that we had, the resumption for the remedial program for students to sit their exams, the most difficult challenge was for the teenagers to keep apart. So our high schools would have sent to us what worked and what didn't work during that program when we had them sitting their exam, and that was the most difficult of the experience. So I know with the babies it will also be difficult, but it is something that we cannot give up on. The Ministry of Health would have said those babies 0 to 2 should not wear the mask. And so the physical distancing is what is key for them, and the sanitizing, keeping them clean, keeping their surfaces clean. The implements and the equipment that they will use, those must be sanitized regularly and they be kept clean. For the babies, as I indicated, we have reduced the student-teacher ratio. So in the high schools, for example, you will see 1 to 20, 1 to 15 based on the classroom. For the babies, you will see 1 to 5, 1 to 8, 1 to 10. And therefore, more persons will be available to see and to observe what is happening in the space. Students will be grouped and they will be on a rotational schedule, so not everybody will be at the play area at the same time. Not everybody will be doing the seated task at the same time. So it's a timetabling that will help to support the safety precautions on the ground. So of course the adults will be in the setting. We would have guidelines sent out already for how parents can enter and not enter those places, how they will drop off and pick up their children, because the Ministry of Health has said we have to reduce the number of persons interacting with the babies. So even for the timetable of the session, the same person for the most part must be settled with the set of students. We can't have 3, 4, 5 different persons coming around and interacting. We have to reduce that. We have to reduce the number of persons sharing a particular space or the set of toys or learning tools that they will use. And if we're going to be using it for another group, you have to stop and sanitize again before. So those are the little things that we have to put in place. The early childhood staff, they have also been trained by the Ministry of Health. We had 2 virtual sessions with them. And for the high school, primary, infant school, we had over 13,000 school staff trained in infection prevention and control measures as they prepare for the school environment.
Okay, and Shalveen Williams says we need more info for basic and primary school children. So I hope that the information that Dr. Troop just gave you helped somewhat. If you need further information, I would encourage you to call our phone numbers 967-7977, or you could contact the Early Childhood Commission directly, or call the regional offices, depending on where you are, and we'll be sure to get more specific information to you. We also encourage you to go to the Ministry of Education's website, and I'm sure the Early Childhood Commission's website as well, where you could see more information related to children who fall within that age group, all right? And Sherry Morris, thank you for your question, and it reads, would like to hear more. Well, she's saying, I would like to hear more about the primary school level, specifically about grades 5 and 6 students.
Okay. So I take it that there's a parent.
Yes.
Okay, so the same kind of blended approach that I would have spoken to earlier will also apply to our primary schools. And the schools will schedule their program according to the approved curriculum implementation schedule, be it a whole day approach, be it a staggered system, be it a rotational approach. So some primary schools, like our very large primary schools, will enter into a rotational approach. Majority of our primary schools, in excess of 500 of our primary schools, will operate a whole day school. So they will go to school as per normal, and they will observe their physical distancing. We will engage all students in September in some diagnostic assessment exercises. So we are going to be supporting our teachers with some testing, just to make sure that we gather enough information to determine where the students are. Are they on par or on the pathway that is designed for them? And if we observe, or whatever we observe in terms of their gaps or where they are, the learning program will be developed for these students to put them on the appropriate pathway and to support them. So our principals will also do make-up sessions in creative ways, be it extended work from home, or if it is that it is safe and we can maintain them, you may have some extended sessions at school, what we have said is that the safety precautions should never be compromised. So for our grades 4, 5, and 6 students, those students will be assessed and their learning programs developed, and that will be communicated with our parents, and the teachers will work with that plan to bring them up to par. Based on what comes out of that assessment data, we will modify the PEP assessments accordingly. No child will be tested in any area that we would not have covered. So we are in touch, and we will monitor, our curriculum officers will monitor the learning plans, we will align it to the curriculum, and we will also align it to the assessment that the students will be exposed to later on.
Okay, and I have a really great question coming your way, Dr. Troop. Will the space at my child's school be held if I choose a homeschool option for the next academic year? That's a great question.
That's a great question. We actually got that question last week whilst we were having a consultation with our principals. And my permanent secretary and I, we agreed that we would want, under this situation, we're in a pandemic, and so the normal circumstances could not pertain. So we are supportive of that request. However, we would have asked our legal unit to review the matter for us to make sure that we are not breaching the Education Act in any way. But in light of the best interest policy, and because parents are making this decision due to the pandemic, we are flexible in making sure that we do not ask that students be denied if they choose, if it is that things improve, and they choose to reintegrate, because parents, the Code of Regulations would have indicated that if you're out of school consistently for a month, that you would have lost your space. And I know that is why you're asking that question. But under this circumstance, we have to be agile, we have to be flexible, we have to be responsive. And so we are open to the idea of reserving that space, because it is not the situation where students will be transferring and the school will be giving up your space at this point in time. People are not moving. So we anticipate that the space will be there at the institution, and we're going to be working with our principals to see to it if we can reserve those spaces in the event that things improve and you want to reintegrate your child. We are just doing the legal review now to be definitive in our response, but we are child-friendly. We want to make sure that our system response in terms of the COVID-19 is non-discriminatory, it's rights-based, and of course, in the best interest of our students. And so we are flexible, and we are willing to accommodate that.
Okay, and I pause just to say, I want to just acknowledge the fact that we have a team of persons here from JIS, Jamaica Information Service, who supported us for this live streaming of our final parent information session. I want to also thank Caroline Brown, who is feeding me with the questions, and my staff out there in the field who are collecting the questions from the different platforms and feeding as well, and certainly to my specially invited guests, Dr. Mara Hussain and Dr. Donna Powell-Wilson, and are you specially invited? Mitzi, are you specially invited guest? No. And of course, the interim president of the National Parent Teachers Association of Jamaica, Dr. Kassan Troop, Dr. Benjamin. I really want to thank everyone for the support this afternoon. So we continue. Dr. Troop, I know this question was going to come because we had a discussion about it just today. And I asked you very poignantly, what is a backup plan? So I want to read two persons who sent in the questions, phrased differently, but means the same thing. So the question reads first, what is a backup plan for when we have a spike? By the way, the person says, which is soon. Okay. And the other question reads, what is the contingency with the obvious continuous increase in the reported cases of COVID-19? That almost sounds like a journalist who is a parent. The second one almost sounds that way, right? Okay, so thank you for, this is an important question. So Dr. Troop, yes.
Very important question. In fact, our minister just yesterday directed that myself and our permanent secretary begin to think about a plan to modify our plan. So you would have been communicating a phased resumption in September, and so we would have seen in recent times a number of persons have been tested positive, and fears are increasing. And so as a Ministry of Education, we also have to reflect on our plans and our programs. And so we have gone back to the drawing board to make sure that our contingency plan is ready and available. Now, our contingency plan, parents, will not look too differently from what we experienced recently in our emergency remote teaching program. So if it is that we are not able to have the face-to-face engagement because of the spike in the COVID-19 infections, we have to engage in the remote teaching program. We really have a responsibility to keep the students engaged. Education is a development sector, and we want to make sure that learning in some form is continuing. We would have had the experience from the emergency remote period of March 13 to the 3rd of July. And so we now have a template. I mean, throughout that process, we were learning and trying to do, but now we actually have a template that is written to include a mixed modality. We are also continuing our discussions with our internet providers to see how we can improve in that area. We have also begun discussion about a national learning management system, and also to partner with those learning management system providers already out there and how we can support their expansion in our schools to make sure that a learning interface is available for students who will be engaged remotely. We also have to strengthen our learning management kits, because we know that there are some areas that will not be able to access the internet. And so the learning management kit is available. And parents, I want to let you know that we moved expeditiously to complete our Ministry of Education content app. So we have an application now that is now available. And in that space, we have learning programs that students can access that is aligned to our national standards curriculum and that can be accessed without the internet. So that is a part of our backup support plan, and that application can be made available to all our students. In fact, we are now uploading that to all the tablets that we have available now, the 40,000 tablets that are available now. We are uploading the app to it. We have also some of our e-resource partners that we are partnering with. We have procured access for their e-resources. Those will be uploaded to our tablets and can be made available to all our learners. And those are accessible again without the internet. So we have learned, parents, and we are putting systems in place to make sure that learning can continue. I can assure you that our televised program, especially at the primary level, we have recorded lessons already, and we are building out that suite so students can be engaged without the internet using the television program. We actually curated the content lessons that we developed in partnership with TVJ and the Schools Not Out program. Those will come back on the table. Remember, we also reached out to our radio program, radio education program. If it is that we have to re-engage that facility, we will do so. So parents, we actually now have a template that we can reactivate, and we will improve if we have to, given the current situation.
Okay, thank you, Dr. Troop. So we have just about 45 minutes left to go, and this next 3/4 of an hour will go by very, very fast. So we are going to answer the questions. I'm going to be throwing them out a little faster, and we're going to be answering a little faster without compromising the quality of the responses. So here we go. This person is saying good night. How nice. Good night to you as well. Will school be provided with the necessary printers to assist them in the printing of notes?
Our schools are equipped with the technological support. They would have also requested additional support for ICT, and that would include printer, computers, and so forth. We are actually providing that support for them. So we know that we have said to our principals that the printed kits and the learning kits should be a part of the mixed modality. We have a responsibility to provide that kind of resource for our teachers to utilize and make sure that no child is left behind. So yes, principals, yes, parents, yes, teachers, whatever that is required for our students to be engaged and to be served and for us to deliver quality education, even in this time of crisis, the Ministry of Education will make the necessary adjustments and provide the resources.
Thank you, Dr. Troop. So you get a minute or so to rest your voice while I ask Dr. Troop to switch hats, because Dr. Troop was introduced also as the National Mathematics Coordinator. Right, so now you know what's happening. I'm not even going to apologize. Now you know exactly what's happening right here. Okay, all right. It is a Saturday, and yes, and we're a little bit tired and loopy, but we're here for you parents through it all. So here we go again. And how very nice. Dr. Benjamin said, I am not Dr. Troop. Thank you, Dr. Benjamin. So Dr. Benjamin being the national, I'm going to remember that for a while, National Mathematics Coordinator. And I want to know, given the fact that we all had to adjust to COVID-19 and the different learning modalities, and the fact is some persons did not readily access teaching and learning. That's a fact. We know there are gaps. We don't claim to be perfect. We know also that the ministry responded as best as it could to those reports where we know that children were struggling, okay? But you have a whole team of persons we call math coaches. How are they going to specifically support children now who might present with some of those gaps in mathematics?
Okay. So, thank you for that question, Casey. So, the Ministry of Education has 100 mathematics coaches deployed across the island, and they are specifically deployed to support schools that our data would indicate need schools that need that additional bolstering as it relates to the teaching and learning of math. And since 2016, the coaches would initially, they focused primarily on building teacher capacity. But since 2016, at both the primary and the secondary levels of the system, they would also help principals and teachers to support students who needed additional support. Our coaches have been they have not been on holiday. They've supported all of the initiatives that Dr. Troop would have mentioned before in terms of the television, radio, and the recorded lessons. And they would have also written more than 300 lesson plans for the system, spanning from grades 1 straight to grade, I think, 11. So that's a resource. We use the time when they could not be on the ground in the school to bolster. We are now looking at how they will function for September, and they clearly will need, we don't want to go out with a model that will, we want to be able to make sure whatever approach we use is flexible and can adjust to whatever takes place on the ground. And so they will offer support remotely. For the most part, they'll be stationed in some schools, and they will offer support to their other schools remotely. And we will ensure that that support is also available not just to teachers, but to students. Critical for us in terms of being able to respond to those learning gaps is going to be the data generated from those diagnostic tests. And they have been supporting the development of the diagnostic tests, and they will support the analysis of the data, which will not just be a national report, but there'll be school reports and there'll be student reports. And so the coaches, according to their schools, will be able to help principals and teachers identify students that we would want to red flag. These really need urgent support, and they will provide assistance on the ground in the development of those learning plans that will target those students to fill in the gaps, strengthen the foundation where the weaknesses are identified, and prepare them to move on. And even though coaches are not available for every single subject area, this is actually the model that the ministry is putting out there for our schools to use, to not just administer the tests, but that analyze the data, create the plans, and implement it so that we fill the gaps that would have been created. As you mentioned, that's a phenomenal education that's all countries are dealing with now. Once students are out, in fact, we know about learning loss just from the summer holidays. So the fact that this is an extended period of learning disruption, we expect that we're going to see some gaps created. And so that's the approach. And our coaches will be on the ground and available. If parents have any specific concerns about their child, through their principals, they can receive guidance and support from their mathematics coach as well.
Thank you, Dr. Benjamin. Thank you. All right. Okay, so is there anything in place for teachers who are high risk, such as hypertension, okay. Is there anything in place for teachers who are high risk, teachers who may have hypertension, diabetes, or who are pregnant?
Okay. So I will answer. I think our doctor spoke earlier about the comorbidities and the fact that we have to observe the regulations and instructions that would have been shared by the government concerning persons with comorbidities. So the disaster risk management regulations would have indicated that those persons should be supported to work remotely. So our teachers, we're asking you, if you have not done so already, to please get in touch with your principals, put something in writing, get your doctor's certificate to support your position, and our principals would have been met with already throughout our consultations at the regional level, and we would have instructed that you be supported to work remotely. I know some of you will have challenges in terms of access to the internet or so. We have asked our principals to put systems in place to support you and to enable you to carry out your duties. What we ask for is open communication and collaboration. We do not want an antithetical environment in our schools. We want our teachers and our principals to work together in the best interest of our children. I know it will be difficult for some of you, and so we ask that you communicate early with your principals so plans can be put in place. Your principals are busy now working the timetables and will be deploying you. They need to know how best to deploy you. Some of you may not be able to teach in terms of where you are because of some limitations, but you will be engaged in planning, in developing lessons, in developing programs, in monitoring these from a distance, in sharing ideas. So your skill set, teachers, will be utilized sometimes in different ways because of the current situation. But as long as you're not on leave per se, you're not on leave, you're not on sick leave, you're on duty, we'll facilitate you remotely and we will work with you based on your skill set in the best interest of the learning program at the school level.
Thank you. And I totally forgot I did tell a gentleman who called the office that I would speak his name because he called asking what we meant by interface. And I broke it down for him. And so I just used the opportunity to remind all parents that one of the reasons we're here is also to break down everything technical so that you are able to understand. We want to make sure you're getting the right meaning, that you're not assuming that this is what we mean. I know sometimes as technical people, we are in our heads and we use all kinds of jargons. But the National Parenting Support Commission, as a policy directive, is mandated to break down the information so that everybody is able to understand. And I think when you understand, you're better able to support. So if there's anything you hear, please call. You know what the number is. It's 967-7977. And I will be more than happy to help you to understand, because that's why we're here. All right? No judgment. That's why we're here. All right. Are high schools to schedule meetings with parents, virtual or otherwise, to discuss back-to-school plans? Some parents are still not aware of the new plans and schedule for the new school year.
Yes. All our schools, not just our high schools, all our schools are encouraged to have their PTA meetings. And I know from where I sit that some parents have been engaged virtually. I'm a parent too, and I've been invited to virtual PTAs to discuss the plans for back to school. So if parent, you have not been called, you're not hearing anything, make contact. with your institutions. You should be by now hearing from them if you have not yet been engaged. But parents and principals are encouraged to have, if they can facilitate the face-to-face, they should entertain that and entertain those who they can on the virtual space. Principals, if you're out there and you're online watching us now, where we're encouraging you, get in touch. Start talking with your parents. Some parents are saying they're not hearing from you. Start getting in touch. Use up the WhatsApp groups, use up the telephone calls, use up the signages, go to the town cry, whatever it is. Remember, they have been away from you from March 13th. And so they need to hear from you. They need to feel the welcoming spirit. They need to get back in learning mode. They need to start thinking about September morning. You know what that is like. So they need to hear from you. So principals, call up your parents for me, please. Get in touch. Start sharing information so they can feel a part of the planning going forward.
Thank you. Nikki Brown, thank you for your question. It reads, for students who do not have an electronic device to complete their studies online, what will happen in this case?
Okay, good question. So we know that some students or parents may not be able to afford an electronic device now. So what we have said to our principals, as they plan, as I said, I'm happy that majority of our schools will be able to operate normally. So you will still be benefiting from the face-to-face engagement using the blended approach. But if it is that your school is operating a rotational model, there is a blended approach that we have spoken about. So not everything will be dependent on a computer or a tablet. So they may not be engaging you in a Zoom platform or Google Suite or any other platform for that matter. You may be working remotely and you will be working with your televised program. You may be working remotely and you'll be working with offline materials. Right? You may be working remotely and you're working with printed materials. So there's no over-reliance. When we talk about this blended approach or remote experience, it is not only about being online. There's a mixed approach that is used, and I need to emphasize this because there's no country now that can rely on the internet only for teaching and learning. It's just not possible. And that is why we don't want the remote experience to be equated to online live internet. It does not mean the same thing. There cannot be an over-reliance on the internet. We have to use the mixed method approach to make sure that students are engaged. So that's what I would say. Further, we have asked our principals to utilize the data on the ground. Do your surveys. Talk to your principal, talk to your parents to find out who have access to the devices and use that information to design who goes on a rotational approach. If it is, your rotational approach will include online interface. So those students who will not have and cannot go online, those students should always be entertained in the physical classroom. And those students with access to the data can now operate virtually. So that is the kind of clinical planning that has to take place on the ground. So that, again, parents, you have to get in touch with your school principals and teachers to share this kind of information.
Shawnice Williamson, why is it that only the students who are on PATH will get tablets?
Okay, the government of Jamaica has a responsibility to provide for those students who are the poorest of the poor, the neediest of the neediest. And so that facility is in place already to support those students. So what you're seeing is really an expansion of the support under that program. And that is why these students are getting this support at this time. Right? So it's not favoritism. These students are actually needy students and need the support of the government. And so that is why we are focusing on them. And for the most part, these students are the ones who need additional support, you know, at this time. And so as a government, we have a responsibility to attend to those gaps in our society.
All right, so this question is coming from Daniel Masters. I'm trying to fix it as I go along. So it reads, reconsideration for shift. I guess is a shift option, okay? For shift, I am a single mom of a child who is 9 years old. Does the ministry have an intention of reaching out to the public and private sector regarding those of us who have a job. Okay. I have worked through all of COVID, and it wasn't easy. COVID is still on, though, but I think I understand what we're saying. That's something we have to continue to reiterate. I'm going to go through it again, but I want to pause just to say the misnomer is that we're out of the pandemic. Let me just reiterate that we're still going through the pandemic. I think I understand because we're on lockdown somewhere March, April, tell me. Right. Persons think because we're slowly opening up back the economy that we're out of it. We're not out of it. All right. So Daniel Masters, here we go again. Reconsideration for those children who might be on shift. I think that's what she's saying. I am a single mom of a 9-year-old child. Does the ministry have any intention of reaching out to the public and private sector regarding those of us who have a job? I have worked through all of COVID and it wasn't easy. Now to consider being making his way to school, which he's not used to, is scary. I guess now that he has to return to school and it's not easy, it's scary. What will happen? Okay, since the school is on shift.
Right. So
Wait, hold on.
I understand. Yes, I understand the fears. It's a very difficult situation for most parents. I want to reassure you that, as I have said from the beginning of the conversations with our parents, that the preferred mode of operation is for face-to-face engagement for the Ministry of Education. And that is why we have worked with our schools to make sure that all schools that can operate normally are operating normally. We went out above and beyond, be it that we have to procure temporary learning spaces, be it that we have to rent somewhere next door, just to make sure that more students are engaged as per normal. So majority of our schools will operate normally. Yes, there may be a few schools that will be on the rotational schedule. Majority of our primary schools will have the whole day approach. So I'm hoping that with this situation, that 9-year-old will be on a whole day approach. We do have some primary schools, that the larger primary schools, that will go on the rotational approach. You would have seen from our bulletin that we don't have many schools going on shift. In fact, just a few schools would have been operating the staggered approach. So there's no school shifting their modality to a shift operation. We have not approved those. The only schools that will be on shift now are those who were on shift already. We are not able to de-shift them now. So very few of our primary schools will have that kind of interface. But for your 9-year-old, we don't have many schools. We have about 22 schools, Kesia, that indicated to us based on their facilities that they would do a staggered. Staggered meaning that everybody will be at school every day, but the time at school will be reduced. So we should not have too many of our babies being exposed to a late shift. And even with the staggered, school should not go beyond 3:30.
Okay.
Right? So you'll see, as I said, 8:30 or 7:30 to 11:45, and at 12 o'clock to a 3:30. So you're still within time that normal school hours would have operated. Only the schools that are on shift will maintain shift. We're not putting any school on shift during this pandemic. There's a few schools with the staggered, which is reduced time, contact time, but they are at school in the day. We have the extended day, and we have the whole day and the rotational day. But let me just say, in the event that we have a few students that are going to be rotating, Casey said at the last meeting that we have to pull on our community reserve. We have to pull on each other, pull on family members. We have to develop our own family schedules, parents. This is a pandemic. There's no ideal situation. So we have to look to see students in the same space. Who can be home today? Who is going to check on you today? We have to develop that kind of a partnership. This is what many of our parents now can relate to, that communal living where the community raises the child, the village raises the child. This is what COVID, in terms of our management approach, will now demand. Everybody has to play a part. We have to sacrifice together in the best interest of our children.
Right. Well said, Dr. Troop. But I also want to just give value to that concern. I know single parents have it really hard. That's a special person, a single parent. You know, many of our families are headed by single-parent women in Jamaica. It's a real concern. So yes, it is very important that you sit down from now and try to make a plan. Don't wait until September. Should it be the case that your child is going to be on the shift model for schooling come September, you have to start planning from now. Talk also to your employer. See what options there are for your job. If it's a situation where you can work from home, then I think that is worth exploring just for the safety and health of your child. If you have a job where that's not an option, then talk to the school. Let's see what the school could help you to work out. And of course, we must find the community care groups. There has to be someone in the community who is willing to take charge of the children. They're our children. And everybody laments when our children are hurt. But here is an opportunity for us to sit down together, come up with a plan that is workable, that's realistic, so that we can promote the best interest of our children. We have to put them at the forefront of our plans. And I'm not idealistic. I'm a single parent. It's so tough, right? Luckily for me, my son is grown now, right? But it was so tough. So I understand very well that this is real concern. And so I'm impressing on all single parent moms out there, single parent dads out there. Please, let's start working together now. Should you need help, the commission is always available. This is why we were created. Parents were not born technical people. Parenting is a technical area, and you develop skills over time. In the 21st century, there's no time for trial and error, right? There are things that we know for sure. So let us sit down, make a plan, and work it out so that our children can be safe, even as they try to access education come September. It's an emotional one for me. Yeah, it's a reality. It's a reality. All right. So let's move on to Debian Whitaker. Debian Whitaker wants to know, what exactly, Dr. Troop, is Simulation Week?
Okay, hi Debian. So when we talk about the Simulation Week, it's really a practice run, a trial run, an opportunity to orientate your students and teachers to the protocols. So students will come into school, they will go through the temperature checks, they will be orientated or shown where to stand, how to observe your physical distancing, what the markers mean, where to go and wash your hands, how often will we release you to wash your hands. They'll talk about the mask, the wearing of the mask, the hygienic practices. All of that will take place during the Simulation Week. They will go from class to class. So we will go to a room, we will have a discussion, we will show, the teachers will show you how do you exit that room, how do we spray the sanitizer, the alcohol, that kind of a thing, the routine, the changes. So when they come back and they are ready for the physical engagement of teaching and learning, they will understand what to do. So it's a trial run, a practice session for the most part, as to what is going to be the new normal. How do we go to PE? How do we go to the lab? How do we sit for lunch? Where do we go for lunch? Will lunch be taken to you? Which group will go for lunch first? How will we do devotion? Some of you are accustomed to this General Assembly. You will not see that come September. That will be modified because the physical distancing will have to be observed. So you will probably be sitting in your classroom, and those schools with intercom will have a devotion over the intercom. Some persons will now have mostly classroom devotion and exercises. Your form times will be limited, that kind of a thing. You will now see how you are grouped during the Simulation Week. So you are not going to be with your 45 classmates all the time now. So you will be seeing possibly half of that. So you will now know which group you belong to and when your groups will come and so forth. You will go through your timetables. What will happen on Monday, Tuesday, Wednesday? When do you go rotation? When do you go engagement, physical engagement? What is your online learning looking like if you're going online? How do you collect your learning kits if we are going to be doing learning kits? All of that information will be shared with our parents and students during your Simulation Week.
Okay, so I'm seeing a bulletin from MOE that grades 1 through to 3 students will return to school September 28. Can you confirm if this is so?
Okay, so what you're seeing in that bulletin is a guideline. So what we had done, parents, is that we had asked our principals to facilitate different year groups each day in the first week of school during the simulation week, and then we would have said to our principals, you can have a group of students starting back in the second week just to make sure that you're not having everybody all at once just in case you can't manage everything. So we gave that flexibility. So you would see a set of students start in the second week and then another set joining the following week by the 28th. So that's a guide. However, schools have the flexibility depending on their level of preparedness to modify that. So you will hear from your principals to say, all my students will start on September 7th, for example, or all my students will start on September 14th, for example. I will advance my simulation week for the first week of September. So that last week of August into the first week of September, some schools will say, this is when I'm going to have my simulation week. And on September 7th, all my students will resume for teaching and learning. Some principals will move into that direction because they want to maximize on teaching and learning time. But again, we gave the guidelines so principals are able to determine if they can accommodate all in a safe space. So the schedule was designed to make sure that we do not compromise on safety, but the flexibility will be allowed on the ground for earlier resumption of some or all students, but not beyond the timeline that we would have provided.
Okay, here is a great question. So what about the students' mental health? Should some children will return to school who have been abused? This is a question. So what about mental health of our students?
Very good question. So we know that some students would have been engaged into counseling programs throughout their school experiences when they were at physical school, and the pandemic would have caused a disruption in that. We also know that it's a pandemic and some persons are going to be affected by this. We have put in place what we call our psychosocial plan. Ms. Carr would have spoken to our parents about our psychosocial first aid that is available. I know she will share some more on that, that we have available to parents and teachers who are also parents that you can call the helpline. And when you resume at school for both staff and students, you will be seeing a series of empowerment, psychosocial sessions being delivered. So our guidance counselors, our health and family life educators, our social workers, and our safety and security unit, they have all partnered together already, and they have developed what we call a psychosocial plan. And this will guide our intervention for the first term of the school year going into the second term. So there will be an intensive level of support for psychosocial care to make sure that students can talk. So there will be talk therapy, there will be play therapy, there will be the empty chair technique. So there are several techniques that your guidance counselors will use to help you to deal with and to cope with what the COVID would have caused for you. If it is that you were exposed to something even more difficult at this time when you are away from school, our guidance counselors are trained. And of course, the referral system is in place. If it is beyond the expertise of our guidance counselors, they normally refer. This framework is in place, reactivated. Our guidance counselors have been trained. Our Ministry of Health team would have trained our schools personnel in psychosocial care. And so there's added knowledge and skill set at the school level to support. We also know, parents, that not all our primary schools have guidance counselors. So our guidance officers in the Ministry of Education, they are networking now with guidance counselors in the different schools and mapping these counselors to share this skill set across our primary schools to make sure that they're also provided for. Our principals would have also put plans in place to access resource persons. So additional persons will be coming in to the schools to deliver psychosocial sessions to help our students to cope with this difficult time, and also to reach out to our parents. A number of our guidance counselors would have started their telecounseling already. We also shifted those students who were referred to the guidance clinic for counseling. The Ministry of Education shifted into telecounseling for these students with the support of UNICEF, who provided the telephones and the data service for the health team at the Child Guidance Clinic to provide counseling. So we are fully aware that this kind of support is necessary, and we have put things in place. We have actually also developed what we call a sample psychosocial plan. So our schools can model their plan from that. That also will be shared in this new week coming up with our high schools and primary schools, so additional support can be provided as a plan for our children.
Thank you, Dr. Troop. Dr. Benjamin, I did get a concern from a parent at the office who was deliberating whether or not his child should defer accessing higher education this year. What's your best advice in that? Should that be left up to the parent to decide, or would you be able to provide some?
Yes, but I would want to encourage the parent, as a parent of a tertiary student myself, if as much as possible, if we cannot disrupt their educational path, we should try and put whatever resources that needs to be put in place to allow them to continue. Sometimes when that gets disrupted, it's very difficult to
Switch mics. Okay.
I'm sorry. Right, so I'm just encouraging the parent, as much as is possible, considering the concerns, noting the concerns, and I stated that I'm a parent myself, so I'm not speaking from head, but also having those concerns for my own child as well. But I'm encouraging parents, as much as possible, avoid disrupting the educational path of your children. I find that when that happens, more often than not, getting them back into that mode is very difficult. And so, even with this extended period of not being in the setting of getting up and going to school, I can see that it has affected each of my children very differently. Some have adjusted fine, and some are just begging to go back out. That sounds like I have a lot of children, don't it? Anyway, but I'm just encouraging the parents, as much as possible, allow your child to progress with the necessary precautions. And my view as well, they have to learn to survive in the world. This is the real world, with all the surprises and the challenges. And we recognize that we can't shield them from it. So the most important thing is to ensure they are aware of the precautions they need to take, that they are disciplined in wearing their masks, that they are disciplined in sanitizing and keeping social distancing. All of that, all of us have to learn it. They have to learn it too. And so I would encourage a parent, just allow the child to progress. If it's just COVID, that's the concern. Allow them to progress and just put systems in place and provide the support necessary.
Great answer, Dr. Benjamin, putting on her parenting hat. Thank you, Dr. Benjamin. So the idea is that we really want to also help our children to develop resilience and to be responsible.
Definitely.
We've been saying that everyone has to be responsible for him or herself. There is a level of self-responsibility that must apply. Okay, so the government can only do so much and no more. I'm giving you a warm time, aren't I, technical people? Is that okay now? Right. Yes, so you have to make sure you're doing what you are told to do that's best for you in terms of the health and safety protocols. And it's okay to model this for smaller children, teenagers as well. The more we normalize wearing the masks and so on, the better is it. Just a sidebar, only because I'm loopy and trying to be funny. It's good if you test which mask fits, because I'm looking at Rupert now, and that mask keeps slipping off his nose. Rupert, your mask might be a little too small for your nose, Rupert. But that happens too. Yes, we're black people, and we tend to be marked by our lovely noses. Yes. Yes. I have a lovely one here too. So yes, Rupert. So you might need a bigger mask, my friend. All right, I'm just being bad. You know, it's a Saturday afternoon, parents, and yes, but we're here for you. Okay, so we're winding down nicely. What a wonderful session it has been. And if I might say so myself, it really has been good to have been able to use this platform, and this is collaboration at its finest. We have the Ministry of Health in terms of Bustamante Hospital for Children. Dr. Mara Hosang is a consultant pediatrician. Of course, you heard from Dr. Mitzi Harris Dillon, who is the interim president of the National Parent Teachers Association of Jamaica. Then you heard from my colleague friend, Dr. Donna Powell-Wilson, who is the CEO of the Council of Community Colleges of Jamaica. Dr. Troop has been here forever. And she's a staple. You know her face. And then Dr. Benjamin has been here throughout it all, too. What a wonderful look. And of course, you're out there collaborating as well, because you're sending in your questions. You have been listening. You clamored for us to change the platform, and we listened, because that's what it's about. So I want to really thank you for that. So as we go to our final questions, and then I'll just wrap up, I get the impression that homeschooling is different from full online school. I don't think some parents are aware. Is there an option to continue full online school, like it was during the March to July period? For my son is an asthmatic.
Okay. Because of that situation, that child will be engaged remotely. So as I said, for our parents and rather our teachers and our students who have comorbidities, based on the Disaster Risk Management Act, the instructions would have outlined that these students be accommodated remotely. So which means that they will be supported from home, right? So teaching and learning engagements will take place in partnership with your schools. So if it is that you have the online facility, the e-learning facility, we will be working with you via that modality. However, as I said to you, whether you are at home or at school, there is a mixed modality that will take place. So though you are being accommodated remotely, you will be getting a timetable, and you will be working along with your school teachers and your principal to align yourself with the timetable. So you are at home and you have math at 7:30, you will go online for math, or you will have the worksheets sent for you, and this is what you will do at 7:30 to 8:30, and then there will be some follow-up conversation via WhatsApp, telephone, or so, to make sure that you are being engaged. Also, you might be told to watch a televised program, so we will build you into the television content materials that are being developed, and you will be engaged through that facility. You may be utilizing the app, the Ministry of Education e-resources. And so that is what the blended approach is. So there's no over-reliance on any one modality. It's a mixed approach. And so working from home, you will be asked to be engaged in all of these activities to continue your teaching and learning program.
Okay, so here's a question. Did the MOEYI meet with the public sector employers to see what these officers... No, so let me change. I think the person meant offices. To see what these offices are putting in place for parents whose children will be at home 3 days per week, if these offices cannot do flexi week.
Okay. Well, the Ministry of Education is always in dialogue with our partners, and so our cabinet, in terms of our ministries, would have had discussions about work arrangements. And if you are familiar with the press briefing from our Prime Minister and other members who are leading in that regard, the Disaster Risk Management Act speaks to how workplaces should support parents, those who have to be working remotely. So there has been appeals for some accommodations to be made. So yes, there's conversation on the ground taking place as it relates to facilitating a flexi schedule, to facilitate distance education, to facilitate working from home. All of that is outlined in the Disaster Risk Management Act. And so both public and private sectors have been asked to make the necessary adjustment to support our workers and parents.
Thank you. So my final thoughts, we would have been told recently that areas of St. Thomas and not St. Catherine, Clarendon, is it not? Mm-hmm. Areas of St. Thomas and Clarendon are under quarantine. So I will give the helpline numbers for those areas. So for St. Thomas, 560-9269. and 788-5409. That's St. Thomas. For Clarendon, 560-9209, 788-5201, and 560-5302. So Clarendon actually has 3 helpline numbers. Permit me to just repeat them. 560-9269, 788-5409. Those are the numbers for St. Thomas. And for Clarendon, 560-9209, 788-5201, 560-93-9503, 560-9503. And I want to just talk to you as we wrap up about psychosocial well-being. It's something we take for granted. So when we talk about your psychosocial health, we're actually talking about how past experiences can be triggered by present-day trauma. So the trauma of the present time. We're living through a pandemic. Many things are going on that cause persons additional stress. And this stress can actually trigger some unresolved past experiences that you've had. How do these affect you? It affects your mental health. In other words, the things you think about. It affects your emotional health, how you feel. You know, some people confuse the two, emotional and mental. Mental is how you think. Emotional is how you feel. It affects your social health, how you interact with other people. And certainly it affects your spiritual health, that relationship you have with God. Now, we have a group of persons who have been trained to man 36 helplines. They have been trained in psychosocial first aid, which is an instant way to treat with the issue you're facing now until further help can be garnered. All right, JIS is telling me to hurry up. All right, so this is important. Psychosocial first aid gives you strategies to deal with the issues now until further support is garnered. This is important. So we are encouraging all of you parents, should you be feeling stressed, should you still be worried, should you still need answers, it's okay. Even if there are things we have addressed here, over the last 3 sessions, we are happy to address them again. Perhaps you were not clear about something you heard because we might have sounded a little too technical. I'm always in my head shifting a word. No, don't use that word. Use this one. You know, always just to ensure that you're understanding. Please call. Our number is 967-7977. We're the National Parenting Support Commission. We're established to ensure that parental participation is existing in all our schools across the country. I really want to thank you for joining us. I want to thank all the persons who came today. It is a Saturday, and you never frowned. You never said no. You came. I'm so thrilled. Mitzi, how are you? Great, right. So Mitzi is great and ready to serve, and the NPTAJ is a really strong partner of the National Parenting Support Commission and the Ministry of Education, Youth and Information. We're all in this together. I want to thank special guest Dr. Mara who sang. Thank you so much. It was so clear, very concise, but very, very clear as to what should happen as we try to help our children navigate COVID-19 even while returning to school. And then, of course, Dr. Powell. Yes, I don't even bother to say Dr. Wilson. That's how much, so close we are, right? So, Dr. Powell, thank you for having come this evening to talk about the Council of Community Colleges. Dr. Tamika Benjamin, thank you so much for having been here for the 3 sessions. Dr. Kassan Troop, as always, thank you. We're always on the phone. We're always talking. So even after we end here, the conversation continues. Also want to thank my team out there in the field, our hardworking permanent secretary, who is always there to support, to give advice. Well, thank you so much. She really loves the children. I want to thank Carlene Brown for being here and all the persons from JIS who left their office to come to ours to do this for Jamaica. Thank you so much, everybody. Let us continue to remain safe, and let us make sure that we're putting plans in place for now, from now, for our children. certain things we can avoid. Let's not be too surprised come September, right? Let's do the things we can do now. Thank you so much. Have a good evening. Great, great. Oh.